for recovery. I wanted to make it user-friendly and make it fun and make it rhyme. I don't know if you can see that from there, but it gives you an overview of what a patient is going to endure when they do come for surgery. And that is in a stand-up acrylic flyer stand in each patient room. And on the flip side, on that left, is the hourly lung exercises. That was the second barrier that I observed right away, is that the patients were confused as to how to perform their hourly lung exercises. They were told 5 different ways to do the same thing. So I took an initiative to create a flyer. Then, as I standardized that, I did a core competency with every nurse on the floor. And then I went down to the CSICU and I educated the managers and the unit coordinators, and they are the champions to get the rest of their staff signed off. So now when they come up, they already have the foundation set, and our nurses daily and hourly, this flyer is in the room at the ready to keep implementing this and getting the patient involved, getting the patient engaged in their own recovery. That is key. I believe that whenever we want to get patients to learn things, it's not just going to pop tall and be there. You can't just do it at the end of discharge. They're overwhelmed. So if we stair step it and we make sure that they understand it, that these are your daily goals, they are achievable and they're realistic, you will empower yourself to do the same thing when you get home. And so on the right side of that screen is an example of what we're going to put in the rooms for the patients, and they are going to check those boxes as they get their pain medicine every 4 hours, because it's important for them to let us know the first sign of pain so we can get them the pain medicine they need to succeed. They're not going to want to breathe deep, they're not going to want to get out of that bed, they're not going to want to do much of anything if the pain is interfering with their daily activities to recover. So that is going in each and every room also. Next slide. Okay, so of course, as I've been talking, it is a proactive approach for positive outcomes, and I believe that if we take the time in the beginning and educate our patients daily, and every time we have an encounter with the patient, we need to incorporate it in the plan of care. A nurse navigator can't be the only one doing this. So I'm taking the time and rounding with the staff and making sure they understand it is a cultural shift. On the front end, it seems like there's more work for them to do, and I know that they're already busy, but it will pay off in dividends when we decrease our 30-day readmission rate, because the patients will be encouraged and empowered to do all these things at home because we started it on the day of admission. And so that's what you're seeing there. So the blue one was for our pulmonary patients, the red is for our cardiac patients, and it is a laminated sign-off. They'll get their expo marker so they can wipe it clean. The one on the right side, I'm implementing a laminated poster. Oops, sorry. That medication, it'll be a poster up front and center where the patient sits in their room, and they will see the medications that they are getting. They'll know what kind of medicine it is, if it's temporary, if it's permanent. We don't want to overwhelm them. They came in with just one medicine, they're leaving out with 10. These are temporary until we get you back and propel you into health. We're going to get you back to where you were, and we're going to get you better, and we're going to improve your quality of life. These will drop off as you don't need them anymore, and it gives them a little user-friendly explanation of what the medication is doing. And the nurses are to use this as a tool every time they administer medicines. And they will update it daily with the patient's initials and the dates. So that's going to also help visual aid those patients. When we assess patients for their learning needs, we need to assess their learning abilities. And did they wear glasses? Did they forget their glasses? Did they wear hearing aids? Did they bring their hearing aids? Do they have a language barrier? We have the capability of bringing in an interpreter, and if we know that up front, we can already have that ready in the room. Some patients are audio-visual learners, so we do have Emmy. We also have a Tiger system that they can watch whatever they want, when they want on the TV. It's definitely patient-friendly. And then, of course, a lot of people like demonstration. So I think it's important just to take the lung exercises. If you take the time to teach them the foundation, and they practice, just like we all practiced when we went to school. We didn't just learn it overnight. We had to practice, practice, practice. And then we got self-confident, and we got motivated, and then we were empowered to continue on and improve our quality of life and pass it on. It is a pebble in the pond effect, because then you are going to tell 2 friends and 2 friends and 2 friends. Next thing you know, I had a wonderful experience. I was frightened. They calmed me down. They told me what to expect. My anxiety went away, and then I was open-minded to learn the things I needed to do to succeed through this process. And I believe there's one more slide, and I'll be quiet. I would say patient and family engagement. As we all know, we need to take the patient's information, and they are our focus. So if we take the time and we find out what their needs are, what motivates the patient, that's going to help get them engaged in their care. If we don't take the time to do that, we're setting up a blocker, and they're not going to learn anything. So what motivates you? What do you want to know? Do you want to know everything, or do you want to just know, how am I going to do on the other side of this? Whatever it is, that's what I would start with. Grab their attention, and then they're going to get more involved and want to participate in their own recovery. So this is the daily progress checklist that they learned how to use while they were an inpatient. On the day of discharge, they will go home with this, and it's partnering not in the hospital. The inpatient one is partnering them with the nurse. This one is partnering them with their caregiver, whoever they designated to help them succeed at home. They shouldn't be frightened on the day of discharge going home, knowing that they've done all of these things at the hospital, and they check it off, and then they bring this back to their clinic follow-up appointment, and that helps the nurse practitioners know how well their progress went on a daily basis, because they're seen within 3 to 5 days, upwards to 1 week, and on the other side is the next 7 days, so they can continue this. Also made a magnet that goes on their fridge, so they'll see this front and center every day.